500 shillings, you no longer get 40 MBs, you get 80 MBs. For 1,000 shillings, it's no longer 100 MBs, it's 180 MBs. Dial *150*10# or use the My MTN app to load bigger daily bundles. Only on MTN. MTN is regulated by the Uganda Communications Commission.
Amawulira malungi paake badde manyikiddwa nga Busafi kati emaze okuyoyootebwa nefuna n'erinnya eppya Entebbe Tax Park. Omuntu yenna adda ku Entebbe Road genda olinyire mu paaka munda Entebbe Tax Park kubanga eyoyootebwa tekyali kutikkira wabweru wa paaka. Bino bikolebwa olw'okuteeka ekibuga kyaffe ku mutindo ogwa Kampala Smart City. Okumanya ebisingawo tukubire ku nnamba etali ya kusasulibwa 0800 299 000 KCCA ku lw'enkulaakulana y'ekibuga Kampala.
Broadcasting from the heart of Kampala, the news on Radio 1.
Brought to you by Standard Chartered Bank. See the future with our new face of online banking or download the Standard Chartered mobile app that lets you do more. Save time every time. Standard Chartered Bank. Here for good.
Briefs on Radio 1. I am Keno Lillian. Coffee cooperatives protest the coffee agreement signed between the government of Uganda through the Ministry of Finance and the Uganda Vinci Coffee Company. The cooperatives are calling for the termination of the agreement, saying it will demoralize the coffee farmers, hence affect the economy. Appearing before Parliament's Committee on Trade, Industry and Tourism today, the board chairperson Bugisu Cooperatives Union, also Wawolo East MP John Musira, said the union was never consulted.
Operational, yet Bugisu Cooperative Union has pending contracts to supply coffee to its customers for the next 5 years. So that is what we do with it. And the forward contract is the forward contract. This Vinci company is a Ugandan company. Mr. Chairman and the committee members, you must take interest in this. The Vinci company is a Ugandan company with headquarters in Kororo, and there is a need to investigate and know its shareholders.
One of the coffee farmers, Robert Kaushinga, warned that if the agreement is enforced, it will create another avenue for corruption. Meanwhile, the Executive Director, Uganda Coffee Development Authority, Dr. Emmanuel Iyamlemye, said they have not yet licensed the Vinci Coffee Company to start its operations. The government, through the Health, Education and Training Department at the Ministry of Education and Sports, has adopted a new strategy that will ensure continuous training and education of health professionals to address gaps and challenges. Commissioner in charge of BITVET at the Ministry of Education and Sports, Dr. Safina Musene, said despite the availability of policies and initiatives to improve health professionals' education and training, a number of challenges still persist, including poor funding. She also warned those operating unlicensed training facilities and also registering students who are below 18 years. President Yoweri Museveni pledges better pay for state prosecutors in the country. Museveni notes that this is better than their appeal to provide more funding for recruitment of more staff. He also promised to fulfill his pledge to inject money in their circle. This at the Joan Kagezi Memorial Lecture in Kampala today.
You are now 300 something. You are understaffed. You want to be 800. As a bushfighter, I would say let's first pay these 300 well. Because if you mix it up with expansion and so on, you will not survive in the Royal Triangle. Yes, they will be overworked, but somebody with a full stomach can work hard. Rather than having so many people who are all hungry democratically. So I would say step one, this 300, let's see what we can do about the 300. I feel embarrassed that I have not fulfilled the pledge to the circle. This one I will fulfill for sure.
The NUP party endorses former FDC party member to lead Simon Akich as the party's candidate for the Moro County parliamentary by-election. The seat fell vacant following the death of former Speaker of Parliament Jacob Olanya in March this year. And recently the NRM party fronted the late son Andrew Jok as the NRM party flag bearer. NUP party leader Robert Chagulanyi unveiled to lead today as the party flag bearer ahead of the 26th May by-election. The Uganda Bureau of Statistics, UBOS, has embarked on preparations to carry out another national population census. The Uganda National Population and Housing Census was last conducted in 2014. The collection effort was carried out through face-to-face interviews by enumerators, administering a questionnaire to all households within assigned enumeration areas. The Executive Director, Uganda Bureau of Statistics, Chris Mukiza, says this time the census will be conducted scientifically using biometric machines. The Uganda Wildlife Authority and police are investigating circumstances under which 3 lions died in Rubirizi district near Queen Elizabeth National Park. Uganda Wildlife Authority spokesman Bashir Hanji says they suspect the lions were electrocuted, but they will conduct a post-mortem. And elsewhere, the Nigerian authorities say they have arrested a suspected drug trafficker, described as a billionaire drug baron, while on board a plane at Lagos's main airport. In a statement, the Nigerian Drug Law Enforcement Agency said investigations had identified Chief Afam Okatu as a major importer of large consignments of tramadol, an opioid painkiller that the agency deemed illicit. The agency said it followed months of surveillance and evading arrest. Spectrum is up next.
Was the news on Radio 1.
Brought to you by Standard Chartered Bank. See the future with our new face of online banking or download the Standard Chartered mobile app that lets you do more. Save time every time. Standard Chartered Bank. Here for good.
On Radio 1 FM 90.
Brought to you by Housing Finance Bank, a financial institution regulated by Bank of Uganda. Housing Finance Bank, we make it easy.
Your views, our interviews on Spectrum, Radio 1 FM 90.
Good evening and a very warm welcome to this edition of Spectrum on Radio 1 FM 90. I'm your host, Iguma Gabriel, coming to you on air and online. We are online www.radio1fm90.com. That's our website. If you visit it, look for the icon that's labeled Listen Live. Today, we shall be looking at accountability in the health sector as we have more and more maternal deaths and what needs to be done in order to stem that problem. Would like to hear from you, so please get in touch with us on this topic. Numbers to reach us on 0703-090-090. That's our WhatsApp number. And for the first half of the show, we will be using that for your questions or your comments. So 0703-090-090, only for WhatsApp messages. Later in the show, we will share phone lines through which you can call and speak to the people in studio. The discussion about the national budget for the financial year 2022-2023 continues, with different stakeholders expressing their views about allocations and also making recommendations, especially in areas that they think are not well funded. The proposed budget for the health sector for the financial year is 2.2 trillion shillings, which translates to a decrease in the allocation for this financial year. Stakeholders pushing for better health care services say this funding is low considering the many challenges in the sector. One of the areas highlighted by these stakeholders is poor funding to deal with maternal mortality, given the fact that each day expectant mothers are dying in labor and sometimes their babies also do not survive. Available statistics show that the current maternal mortality ratio in Uganda is 336 maternal deaths per 100,000 live births, while infant mortality is at 43 deaths per 1,000 live births, with 42% of the mortality occurring during the neonatal period. It has often been argued that most of the expectant mothers and their babies die due to lack of simple but critical supplies in health facilities. These facilities, according to stakeholders, require an effective budget that has not been forthcoming for many years. So tonight our focus is on the health budget and how it can be used as a tool to deal with maternal mortality issues. In studio, we're joined by Dr. Herbert Luswata. He's the Secretary General, Uganda Medical Association. Good evening and welcome to Spectrum.
Yeah, thank you so much. Thank you for inviting me today.
Also in studio, Mr. Peter Echweru. He is the Program Coordinator and Advocacy Officer at the Center for Health, Human Rights and Development, that's CEHAD. Good evening and welcome to Spectrum.
Thank you very much. I'm glad to be here.
All right. As we get into the discussion on the health budget and, maternal mortality in particular, just first give us a broad picture of what it's looking like as discussions for the next budget, are happening, especially when it comes to the health sector.
Okay, thank you very much. This conversation around maternal health is a very critical one. And we think it is one that everybody must get involved in, because one way or the other you'll interface with a public health system at some point in your life. And so it's important that this conversation gets the attention it deserves. So currently, if you look at the statistics that we have, when UDHS was when UDHS was done in 2011, it was then that we had over 400 mothers dying due to childbirth. In 2016, it had reduced to 336 mothers dying for every 100,000 women that were going to a public health facility. Now, that shows you that we are making progress as a country in terms of dealing with the question of maternal mortality. But the numbers are still stuck there and we are not making progress. If you look at statistics from the Ministry of Health, the number of mothers who are dying and getting registered in public health facilities actually have stagnated for the last about 3 years. That shows that there is a missing link somewhere. We've stagnated. Remember, these are the ones that are registered in a public health system. The nature of our community is that there are those that actually die outside the health system. What we are saying is stagnant is those that have died within the public health system. So that is where the challenge, it demonstrates to you what the exact problem is, that we are not making any much progress in terms of death in health facilities. And statistics show that actually the hospitals that we think would be the best to save lives, the ones with experts, the ones that we presume to have equipment, the regional referral hospitals, is actually where most of the deaths happen. Over 40% of the mortalities that happen in this country happen in health center 4s. I mean in the referral hospitals. And the lowest happens in health center 2s. Someone may ask a question and say that, but health center 2s are not supposed to do deliveries. But the truth is that in this country, health center 2s, while not equipped to do deliveries, are actually doing deliveries. Now you'll notice that most of the death is happening at referral and then at health center 4s. Those are the ones with the highest. The lower the health facility, the less the death that are happening in those facilities. And when you look at what exactly is causing this death, you'll notice that most of the death is being caused by preventable causes that we would ordinarily be able to avoid. One of the causes of death is the question of hemorrhage, that most women die because of loss of blood. And most of this loss of blood happens after the child has been born, not before childbirth. So about 90% of those deaths are a result of postpartum hemorrhage, meaning that the mother has delivered, but now the blood has come and we do not have mechanism, in most of the cases, of how do we stop the bleeding. Okay, so about 40% of this death fall in that category. Then you have the rest arising from things like sepsis, which is when a wound begins to have problems. Then the other ones are some related to things like abortion. But the biggest cause of death is because mothers lose blood. And when you go to a lot of health facilities, you discover that they actually do not have blood within the health facilities. We've, as an organization, litigated in a number of cases where mothers have died during childbirth. And the story is usually the same. They went to a health facility, they were not attended to, they got into an emergency situation, they start losing blood, there's no doctor to attend to them, there is actually no blood even within the facility. They are saying, oh, now you need to run to the regional referral hospital. Okay? So that is where the problem is.
All right. Well, let me bring Dr. Luswata into the conversation. the organization that Mr. Echeru is from, looks at these things, does activism, they do advocacy, but you are the ones in the trenches. What is the actual situation on the ground? And usually what happens is, based on situations, people find a way of coping. So how exactly are the medical, practitioners coping with the dire situation that Mr. Echeru here has described?
Maternal deaths in Uganda are still very high. I think last year we had 16. I don't know. Let me not quote the figures because they have changed. He will give us the figures. But the numbers are growing. And the biggest challenge we have here in Uganda, one of them is the child mothers. These are the young girls who are getting pregnant before they are of age, before 18 years of age. And the biggest reason as why this is coming up is poverty. We have a lot of poverty in our community. Many people are living below the poverty line, if I can say that. These young girls are not going to school. These young girls do not have what to eat at home. As soon as they start menstruating, the parents are thinking of giving them away into marriage to get money. Some of them are looking for money to buy pads from men. So it is poverty is a big problem and the challenge which has brought up this. Now, most of the mothers who are dying, who are contributing to these maternal deaths in Uganda, are these young children, the child mothers who get pregnant. Before they are of age, they contribute the biggest percentage. Now, when it comes to the hospitals, in many of the lower level hospitals, we don't have the human resource that we need. We don't have doctors in many of the sub-counties, and this is where most of the problems actually take place. And it's from this basis that the President suggested in the parish development model, we should have a doctor at health center 3 level. Was trying to solve this problem. However, before we go to the health center 3 level, we have the health center 4 where we have the same problem of low staffing level. At the health center 4, we have only 2 doctors. And these are the doctors who can save mothers when they are afraid to deliver, to do the cesarean sections, to conduct difficult vaginal deliveries at the level of the health center 4. But there are only 2. And these 2, when they work during the day, they cannot work at night. So you find that most of the health center 4s, even here in Kampala, are locked. They are not working at night. So you realize that when the mother gets a problem at health center 3, they are referred to health center 4. And at health center 4, because it is closed, they again have to be referred to district hospitals and national referral hospitals. In this is where you lose most of the mothers. Delays to get the health care they need. So we have a problem of the human resource in these health facilities. We have a problem of equipment, the things we need to use down there. Many times you can even reach, sometimes we go for visits ourselves. Sometimes I go to my village, I go to visit. But then when you are there, they know that there's a doctor around in the area. When some people are at the health center for, they know around, you see people coming for you, that there's a mother who has failed to deliver, you're a doctor here, and district hospital is very far. You say, okay, let me come and give a hand, because I'm a public servant and I can work in any government hospital anywhere. My license allows me to do that. But you reach and you don't even have the small equipment to conduct a cesarean section. So you end up using circumcision sets, improvising with a few things to save a mother. At worst, you fail even to get standard equipment to work on these mothers. It is happening in very many local areas down there. Let me come back to Kampala. Here in the central, most of our health facilities are high volumes. They are there at their own level, like health center 4. When it comes to supplies, there is a predetermined amount of supplies in terms of drugs, gloves, and other things which are supposed to come to these health center 4s. But realize that this predetermined amount of supplies is very low compared to what is required at these levels. They provide mama kits for these mothers for 3 months, and in 1 month all the mama kits are over. In 1 month all the magnesium sulfate is over. And when mothers keep coming, there's no mama kits, they don't have gauze. That's why you see many mothers are being sent to go and buy gloves, they buy gauze, they buy jig, they buy all these things, taking them to the hospital. Even here in Kawempa, the National Referral Hospital. So equipment, the supplies are not enough. Here in Kampala, these hospitals are high volume. The budget for these hospitals needs to be increased so that they can accommodate the high volumes. They are supporting.
All right.
Yes.
I totally hear you on, there being a critical need to increase the funding and to increase the supplies to these facilities. However, there have also been concerns around the misuse by health workers of these supplies, where sometimes the medical stores have said, we supplied the quantity that would take them for 3 months, but, it's hard to account for where, those supplies went. So internally, as medical practitioners, are you also ensuring that in the scarcity, there's also no misuse and abuse?
Yes, we have talked about this a lot of time. We talk about medical misconduct and unprofessional practices. We know that there are some of our colleagues who are doing these dubious things down there. There have been cases of where health workers have been caught actually selling mama kits, which are supposed to be given to these mothers for free. And we have tried our best, and up to now we condemn these kind of practices. We have been condemning the practices of some health workers when they're supposed to be on duty. Mothers come when they are not on duty, and they have got complications during delivery because of such. So we also condemn such, happenings, and we urge all our doctors and health workers, when it is time to be on duty and serve. And when you say that you are not on duty because you are very few and you are tired, let it be a fact, but not something you just said as a scapegoat. Yes, and yes, we know it is little, but it can do something. When it is there, let it work. That little, let it serve the purpose it's supposed to serve. And when you say the government needs to give us more, let it be a factor, not because we have stolen these small things.
All right. Speaking of, needing more, Peter,
Yes.
the explanation that's usually given is there's a limited resource envelope, and therefore there's got to be some kind of prioritization. And so not every, the sectors cannot get everything that they ask for. And yet, when we look at figures like 16 mothers dying every day, and it's so unfortunate that we've quoted this number for more than 10 years now. How do we reconcile the two? The limited resource envelope and, the fact that these deaths, if a few things, the things that you spoke about could be done, are actually preventable.
Let me start with what you asked my colleague about misuse of some of the supplies. That's indeed true that it happens. But also we have to be realistic about what we supply and what we expect from the supplies that we give. I'll give you a quick example. We did monitoring in Arua district. And in one of the health facilities we went to, they would receive 32 mama kits for a period of 3 months. But they were doing between 50 and 70 deliveries every month. So you can see that it is way below what the health facility needs. Now, in terms of saying, yes, we have limited resources, the question is, how do we prioritize our resources? What are our priorities? And for me, my contention has been that our priorities are just wrong. We get our priorities wrong. I think health, the question of life, is very important, that we need to see that we provide resources. A number of other sub-programs within the government have continuously had increases in budgets. But for health, it has been the opposite. We are actually, government commitment towards health is reducing every year. As the government contribution as a percentage of the health sector budget continues to decline. If you look at the Kenyan example, Kenya has what they call the Big Four agenda. And one of the things in the Big Four agenda is health. And I can assure you, because Kenya has already passed its budget, because they are in an election year, so they pass it way earlier than we did. They're only waiting for the reading. Health is one of those, you match talk with resource allocation. What shows your priority is determined by how much resources you put within that sector. So for us, if you look at the NRM manifesto, it talks a lot about how they want to improve key indicators within the health sector, improve universal health coverage, and ensure that we have 100% of approved positions in the health field. Those are all commitments they make in the manifesto. But you see, this talk is not backed up by resources. We just talk and talk and talk that this is a key sector for us. But in terms of putting in resources, we don't put the required resources within that sector. So if you look at the last 6 months, the last 6 financial years, you'll notice that continuously we began from 8.9% health as a percentage of the national budget. Now we are at 6.1. If you look at how much government contributes to the health sector budget, government contributes only 57% of the health sector budget. The rest are donors. Okay? Now, even of the 57%, the 54 goes into recurrent expenditure. That means buying fuel, repairing vehicles, these small expenditures. But when you want to do capital expenditure in health, government only puts in 3% of the 57 that it contributes. So that shows you that without foreign help, our health system will collapse, because as a country we have decided to abandon health to individuals. We have, it's estimated that as a country, we spend 7.5 trillion on health. We are not talking about budget allocation. We are saying as a country, that people from their pockets, from donors, from government, it's about 77.5 trillion shillings. But of this, government contribution is about 40% of that big contribution. And individuals contribute 42% of that.
The so-called out-of-pocket.
Yes, the so-called out-of-pocket expenditure. Now, the World Health Organization recognizes that for you to have a system that will have universal health coverage, individuals must not spend more than 20% of their expenditure on health. We are in more than double that. And you know the danger of that is that when you go beyond 20%, then when a catastrophe hits the family, a health one, you're sending people into poverty straight. And I have always argued that, you see, we have all this parish development model. We have a MIOGA. If we do not deal with the question of health and fix the health sector, all these other economic projects that government is trying to implement will collapse. Because a child will not die in a family while there is an MIOGA cow tied under the tree. Or that you bought for this group equipment and they will let their children die while the equipment donated by government is there. The first casualty will be that cow will be sold to cater for the cost of health care. So we need to have a public health system that supports families and relieves them of the burden of health care so that they can use the money to invest in other productive engagement. So that even when government brings in these other programs, they are basically used to generate additional income, but they should not be disposed of to deal with the questions of what? Of health.
All right. We need to take a break at this point, but would like to let you know that you can contribute to the conversation that we are having on the health budget, particularly looking at maternal mortality and what needs to be done, to improve maternal health in the country. Send in your views, questions, and comments using our WhatsApp line 0703 090 090. When we return from the break, we will hear some of the recommendations that our panelists are making, but we'll also sample your feedback. So stay tuned, because that is coming up after these messages.
Spectrum on Radio 1 FM 90.
Gather your loved ones in celebration of Ramadan at the Sheraton Kampala Hotel. Break your fast with a sumptuous iftar buffet in the lavish setting and ambience of the Al Khaima tent, complemented by beautiful Sufi music at Lake Terrace for 100,000 shillings and half price for kids. Groups of 10 will get a 10% discount. A prayer room is also available. For inquiries, call 0312 322 499 or 0752 711 191 or Email foodandbeverage@sheratonkampala.com. Ramadan Kareem.
Some people see the low fuel light come on and say,
Mafuta is done again. Anyway, let's go. I know my car.
Others see it and panic.
Look, I put fuel yesterday. How is it done already? What should I do?
While those who use Shell Fuel Save see it and say, absolutely nothing. Because they know that Shell Fuel Save is designed to improve engine efficiency so you can get extra kilometers out of your drive. Shell Fuel Save with Dynaflex technology lets you enjoy extra cleaning, extra protection, and extra savings. Fill up at Shell because extra kilometers go a long way. Terms and conditions apply. Shell, go well.
So, what are you in the mood for? Football. Party. Travel. How about we add a little now special? The rewarding 330 ml Now Special Shorty for a special kind of mood. Now Special. True Ugandan reward from the source. Alcohol is not for sale to persons under 18. Please drink responsibly.
Spectrum on Radio 1 FM 90.
Welcome back from the break. Thank you for staying with us here on Spectrum, Radio 1 FM 90. I'm your host, Iguma Gabriel. Today we're looking at the health budget, particularly maternal health, and the allocations for that. For a long time as a country, we have said that we lose 16 mothers per day to preventable deaths. In some circles, I've actually had that figure quoted as 18 mothers a day. If you'd like to visualize that, look at a matatu taxi that takes 14 people. In this case, you are now adding the driver, the conductor, and 2 extra passengers that should not be in there in order to make the 18. It's a very, very, grim picture there. Well, our 2 guests, Mr. Peter Echeru, he is Program Coordinator and Advocacy Officer at the Center for Health, Human Rights and Development, CEHAD. Our other guest, Dr. Herbert Luswata, the Secretary General, Uganda Medical Association, are the ones discussing this issue. Well, Dr. Luswata, you did mention earlier on how, health workers are coping. It was shocking for me to hear that, they're using, in some cases, using circumcision equipment to do cesarean section, and that is for the easier procedures. As, medical workers, what have you done to try and get these issues solved, and the duty bearers forthcoming?
Now, as the health workers and the Uganda Medical Association, we have engaged Minister of Health and government at large. At different levels, we went even up to State House, and we wanted to solve, the welfare of health workers and the whole system at large, including the patients we've been taking care of. We had a meeting in State House in November last year, and we discussed these things, and we told the President the truth, that you voters down there are suffering in our hospitals. They come, and we don't have enough medicine. They come, we don't have the equipment. And we gave him very many examples, including one of his ministers and MPs, the cadres he already knows, and the reasons he already knows. And the President was very receptive on this matter, and actually apologized that he didn't know that some of these things are happening. How I knew this is when we talked about dialysis patients in the Chirudo National Referral Hospitals, when he learned that they have to pay money for dialysis in a government hospital. And yet, according to him, they were providing money to buy the reagents for the dialysis. The President, to this effect, he gave a directive to the Minister of Health and the Minister of Finance to ensure that the equipment and drugs in the hospitals are purchased instantly and ensure that Ugandans stop suffering. Then he was also informed that different hospitals have a cap. They have a budget, and the budget have a cap which cannot be exceeded, and yet the number of people these hospitals are serving are much more beyond what is on the cap. And he promised that they will discuss as cabinet and see how they can increase the budgets for different hospitals and people be able to get enough supplies. Now, in the budget, today I had an interaction with the deputy chair of the Health Committee of Parliament, and I was informed that the budget on medicines and the supplies has been increased at least for the financial, which is going to start in July, and that was a very good thing. He also informed me that because we have been agitating, the government promised to increase the salaries of doctors and health workers at large. That was also another big problem. And he just informed me today that actually the salaries for our senior consultants, and the medical officer special grade, and other health workers, and the directive of the president of having the entry-level doctor earning 5 million is going to be implemented. I think that is a plus to government. It is going to motivate the health workers to work better.
We surely have just before you continue that point, we surely have been in this place before, where pledges are being made, where even in the budget in the health committee, those figures are discussed, and then when the final budget is passed, the figures are not there, or at disbursement, the disbursement is not made. What makes you sure that this time round it's going to happen? Because yes, these are needed, interventions.
Now, we went for a strike as Uganda Medical Association when we failed to get the attention of government through dialogue. But then later we suspended the strike when the government physically deposited money on some of the doctors' accounts. These were allowances for the intern doctors and the senior house officers. We saw money, and we had to see, evidence that people had received money on their account, because we needed to see action that time round. The government provided 35 billion that time, which came to Ministry of Health in different hospitals, and the interns and the senior house officers got this money. There is also a document which came from Ministry of Public Service on the planned increment of salaries. It is reflecting the 5 million for the entry-level medical officer, but does not include the increment for the senior consultants. So we sent a message to government, and we told them that we suspended our strike, but we promised that we shall resurrect this strike or resume in case we see that the final budget is going to be passed and if things are not there. So,
all right. If I may ask, one of the issues that Peter pointed out is, as you know, one of the solvable issues is the issue of blood and the lack of, or the fact that blood is not available when it's needed in some of these facilities. As a person who goes through this day to day, how do you suggest this blood issue is solved?
The budget for blood, blood has been a problem for quite a long time, but because they lacked financing. Initially, Ministry of Health was in charge of the blood transfusion services, but to make it better, they devised means of making it autonomous under Uganda Blood Transfusion Services, which has a different leadership, management, and financing separate directly to them. And actually, every year the budget for Uganda Blood Transfusion Services increases by 5 billions. However, we need to do more, mainly when it comes to the personnel who are working there, because many times you find that you go to a government hospital and you cannot find blood. And yet when you go to a private hospital like in Zambia and Uganda, they actually have blood. And these people are using resources of government to actually collect this blood. So I think there's also a problem somewhere that it is more into the private facilities where probably some people are collecting some coin over it, and it is lacking government. And I think we need to check ourselves as doctors, and maybe Uganda Transfusion Service need to work on that. If it is available in private health facilities and is on government's money, it should be first available actually in government hospitals. Then the other thing is we need to increase the capacity of the Uganda Transfusion Service so they can collect more blood in different regions of the country. We know that different regions have been given centers where they can actually collect this blood, like we have the Blood Transfusion Service Center in Mwende. There's another one in Mbarara. However, other regions do not have. So we need to expand it further. And then on the side of Ugandans, we encourage them to always, when there is a call to donate blood, please come on board and donate.
All right. Peter, you did talk about earlier, in passing, the fact that SEHAD has litigated in relation to, mothers who have found an issue in the health facilities. And there is that landmark case, petition 16 of 2011, and the decision of the Constitutional Court in relation to that. After that case, have we seen any changes?
So, Petition 16 was indeed a landmark case. It was a landmark judgment where questions of maternal health were really raised, and specifically the quality of service that we provide to mothers. That includes, do we have adequately trained personnel? Do we have adequate resources that can facilitate quality maternal care in our health system? So that was indeed a very important judgment. Now, in terms of are we achieving much from that judgment, it is both a yes and a no, because there are areas where we have made progress. And one of those areas where we've made progress is the commitment of one of the directives of court calling on the Ministry of Health to conduct a maternal health system audit, to be able to understand actually the challenges that are within the system. And we believe that once you have that audit done, then you're able to effectively address where the shoe hurts the most. You begin to put resources in those areas where there are huge challenges that are causing a lot of this death. And I know that the Ministry of Health is in the process of having this maternal health system audit in place, and it is in advanced stages. So in as far as that is concerned, we believe that yes, government is doing a good job. We are making progress, because we hope that once we have that, then we have a mechanism through which we need to address the challenges that arise. Remember, the directive of court was that conduct a maternal health audit and submit it to Parliament. Parliament has the responsibility of passing budgets, and so that should be the basis upon which they will now allocate resources. But in terms of the call by the court to increase resources for health, we've not yet made progress. A lot of things have been the same. Actually, on the issue of blood, for example, we are stuck at 17 billion for Uganda blood transfusion service. We are also stuck at about 420 billion for national medical stores. Most of these things have not had any fundamental change in terms of the amount of resources. It is indeed true that throwing money at a problem does not solve a problem. But there must be a beginning point. You're not going to say that you want additional staff when you don't want to put in the money. You do not want to say that you need more blood when you're not putting in the money. It is projected that this country actually needs 420 units of blood annually. But the resources that are currently given to Uganda Blood Transfusion Unit can only give us about 300,000 units of blood. Remember that you must...
So what's that 430,000?
We are only able to collect...
No, what is the need?
The need is 420,000 units of blood annually.
Okay.
But the resources that Uganda Blood Transfusion Service has can only enable them to collect and process 300,000 units of blood. So that still continues to be a huge challenge. So if you go to Uganda Blood Transfusion Unit and you look at the trucks they are using, the vans that they are using for their outreaches, they are in such a sorry state. And so the health committee, when they are considering the national budget framework paper, had argued that, you see, we need to replace all this, and they laid a plan on how they can manage Uganda Blood Transfusion Service by consistently increasing their funding so they are able to have good equipment and all the things at that place.
Okay.
So in terms of some of those things, we continue to have a challenge. So it's important for government to sit back, because otherwise what could be happening now is that government is actually in contempt of court. Instead of increasing as the court directed, what you're doing is to decrease actually the amount of resources that have been provided. That is in contempt. For us who deal in human rights, and for those who understand human rights, the standard is that there is need for progressive realization of some of these rights. it means that, yes, we do not have all the resources we need, but you must demonstrate that progressively we are increasing something.
Okay.
That's how the commitment.
All right. Gentlemen, I'm going to come to both of you for, your general recommendations on what needs to be done. But now I would like to open the phone lines and to also share our WhatsApp line to get listener feedback. So if you have any question or comment, if you'd like to suggest ways in which, the health sector budget can be improved, especially to deal with the issue of maternal mortality, the WhatsApp number to use is 0703 090 090. That's 0703 090 090. If you'd like to call in, the numbers you can use are 0414 346 111, 0414 348 111, 0414 348 411, 070790 9097, and 0774 076 394. Those are our numbers. Doctor, if I could begin with your recommendations.
Yes. We have suggested for a long time now to have a national health insurance bill in this country. National health insurance has worked well in other countries like Kenya and Rwanda. And actually, Rwanda, the policy they are using under their national health insurance bill is we adopted from Uganda. And it has worked well in their country. I don't know why we are fearing to start it in Uganda. If every family or every head of a family contributes some amount of money to this insurance every year or every month, it can kickstart, and we can because we shall say that the services in government are free, but we have seen people are already spending a lot out of their pocket. They come to hospitals and they keep spending money. They themselves, they know they don't actually get free services from government. So delaying the bill is a wastage of time. It is better these people put these people into the national health insurance bill. They will spend less and will get better services. And actually, government will be able to get enough money to solve a lot of problems. We shall be able to buy enough supplies. We shall be able to get enough money to deploy and employ more health workers to help the mothers. The salary increments, we shall have enough money available to increase salaries of health workers and keep them motivated. We shall have enough money to buy equipment. This insurance, it's a big gun which can pull a lot of money. You heard about the Inter Express Highway where people, you just pay 5,000 whenever you pass. But I heard in one day they made over more than 200 billion in one day. Just a road. Now, what can the national health insurance be? Where every Ugandan is contributing, if it is 2,000, it will be a lot of money to solve a lot of. It will be a very big resource. I think we need to also stop to look so much into the donors who will come and help us on everything. Actually, it's like a government abandoned health to the donors, which is truly very wrong. They are putting a lot of money in very many sectors. Like in security, they always prioritize it. The roads, yes, it is okay, but it has been the same story every year, and health has always been abandoned. Whenever we bring about matters of health, the government looks, on the other side. People have to first strike. People have to first demonstrate. The government needs to own the health sector and finance it. Yes.
All right. Mr. Echero?
Yeah, he has spoken well about medicine, about insurance. That is the way to go. One of the ways, alternative ways of financing health. Then the other question, in our monitoring of health service delivery, one of the things you consistently find is the question of medicine. And if you look at what we give towards medicines, it is really inadequate. We've been at around 420 billion for most of the years. Then last year we moved towards 600 billion. And we're excited about that increase, and we thought it would be a good one. But surprisingly, again, this year, 2022-2023, we are seeing we are going back to 400 and something again. They're saying the other one was because of COVID, and that's why we sighed. But again, if you look at National Medical Stores projections that we need, we actually need in excess of 1 trillion shillings for medicines in this country. So when you're giving only 400 billion, then you know that we are really under financing the medicines. And that's exactly the reason why in most cases you go to a health facility and there's no drugs, because the drugs delivered are very minimal. In most places we've been to, they tell you that within 2 weeks the drugs are actually done. And so it is one area that as government we need to put in money. And then to strengthen our referral system for pregnant mothers. How do you refer a mother from a health center 3 to a health center 5? If you're in Kampala here, you get mistaken to think this represents Uganda. In this country, there are areas where 10,000 shillings is someone's salary for a whole month. Okay? And so when you're asking them to just get a border to transport a pregnant mother to a health facility, you're really asking for so much. So we need to have a national health insurance, a national ambulance system in the model, for example, of Rwanda, where you have a unique call center where anyone who needs a call, who needs an ambulance calls into that system, or even for someone who is in a health facility but needs to be transferred to another health facility, they are able to immediately get transferred to a higher health facility. The current financial year, the Ministry of Health had proposed a national ambulance system and had proposed 20 billion as a kickstart package to jumpstart a national health ambulance service. It was never funded. Again, if you look at the current National Budget Framework paper, it again also indicates the same thing, that the Ministry of Health has proposed 22 billion to jumpstart the national ambulance system. But again, they are saying it is an unfunded priority. We think that if you deal with the challenges of referring pregnant mothers and the dangers associated with the delays to seek treatment, the delays to get to a health facility, and the delay to be attended to by health worker, you need to have a functioning national ambulance system. And then, of course, the question of human resource. Remember that currently, we have only 74% of approved staff positions filled in this country. Only 74% of approved staff positions are filled. The current staffing structure was established in 1999 when we were 21 million Ugandans. That's why they say for Health Center 2 you need 9 staff. Remember that at that time it was projected that Health Center 2 would serve 5,000 people. Now we have Health Center 2s that are serving 25,000 people, but they are still operating on the same staffing structure. So it is important, one, that we recruit to fill the current staffing structure to 100%. But it's also important that we review the staffing structure so that it responds to the current population pressures that these health facilities face. But the way we are now, you find mothers lining to be attended to in a health facility. This one gets off the bed, the other one jumps in. That is totally a difficult situation. We were in Kapchora, and we were told that, you see, that bed you see there for women who are delivering was given to us by the whites before around the 70s. That's when it was given, and it's being used up to today. So it is one of the things that we need to look at. And then the question of equipment. We are having a lot of unnecessary referrals from Soroti to Kampala, from Arua to Kampala, simply because the doctors who are there do not have equipment to use to treat this person, to help the person. So you get transferred for no good reason, but for lack of equipment. So we think that government needs to finance equipment. And the Health Committee of Parliament, in a report which was actually adopted by the whole House, had made a proposal that, you see, can we have regional workshops financed and equipped properly so that they handle equipment challenges at the regional, for all those health facilities within the region, at a regional level. So that once an equipment breaks down, they are able to be repaired. And that's one of the big problems. One time the Auditor General did an audit of one of the projects by the US, I think it was USAID. And it discovered that actually, while we had a donation to buy equipment, by the time, 5 years later on when they were doing audit, most of the equipment were lying in the stores because they could not be repaired. They're just lying idle. Now you have a situation where there's no x-ray, but a gentleman who is supposed to conduct x-rays is being paid. So he comes in the morning, he dusts his table, he sits up to 5, and he leaves and goes. But he's doing nothing because there's no equipment that he can use. Okay? And it is not just a few. Just go to Naguru here and ask them for an x-ray. You find mothers lying there because they cannot afford little money to go out of the facility to conduct, I don't know, how do they call it?
We're looking for the technical terms.
Yes, that one. You have to run out from a national regional referral hospital.
All right.
That kind of basic equipment is missing.
All right.
It is one thing we need as a country to really think deeply about ensuring that we have equipment. We have qualified, experienced doctors, but they don't have equipment to support them do their work.
Excellent. We're out of time, so I'll just allow each of you just a few seconds to give a parting shot. Doctor, I will begin with you.
Yes, thank you so much. I think the government needs to wake up and surely put their thoughts on health, on very many things we have discussed here, from equipment, staffing, the healthcare system, the infrastructure needs to be improved in very many areas. Then the issue of drugs, and we have talked about these things for a very long time, and we expected that maybe by this time, it has been a full year.
Right.
We expected that by this time there will be change, and maybe you could see many changes happening in the budget. But it's unfortunate that the changes are very little. So we implore members of parliament to ensure that the budget is increased for health.
All right. Mr. Chero?
You see, government has
Very briefly, though.
Government has for a long time said that we promote women empowerment. But I think the place where the women need government the most is at this point of giving birth to life.
Okay.
That is the point we need government. And government must demonstrate that it is standing with the women by putting in resources here and supporting maternal health.
Mr. Peter Echweru, Program Coordinator and Advocacy Officer from SEHAD, and Mr. Dr. Herbert Luswata, Secretary General, Uganda Medical Association. Thank you for being on Spectrum tonight.
You're welcome.
Dear listener, thank you very much for being a part of today's edition of Spectrum. We return tomorrow with another edition. From me and our guests for tonight, it's a good night. God bless you. Stay tuned. The news is coming up.
Gather your loved ones in celebration of Ramadan at the Sheraton Kampala Hotel. Break your fast with a sumptuous iftar buffet in the lavish setting and ambience of the Al Khaima tent, complemented by beautiful Sufi music at Lake Terrace for 100,000 shillings and half price for kids. Groups of 10 will get a 10% discount. A prayer room is also available. For inquiries, call 0312-322-499 or 0752-711-191 or email foodandbeverage@sheratonkampala.com. Ramadan Kareem.
We know these times have been challenging, but also believe that business shouldn't stop, whether trading inland or across borders. Tambo's a business with our trade finance services that are designed to make it easy for you. Talk to us today for bank guarantees, import and export financing, certificate and invoice discounting, import loans, commodity financing, contract, LPO financing, and more. Contact our trade finance team on 0704-252-833 or WhatsApp on 0790-542-262. Housing Finance Bank. We make it easy. Housing Finance Bank is regulated by the Bank of Uganda. Customer deposits are protected by the Deposit Protection Fund of Uganda.
Shorty.
Ichoti, that one.
Shorty.
Soti.
Shorty.
Shorty. Hey, Shorty.
Shorty!
That one is Soti.
Hey, Shorty.
Open a Soti.
Say differently, refresh is the same. In a cool size bottle. The refreshing 330 ml Club Shorty is back. Club, refreshingly different. Alcohol is not for sale to persons under 18. Please drink responsibly.
Please put on your mask if you're to enter here. Musao, you know very well that I'm fully vaccinated with 2 doses. So, why wear a mask? Wash hands. Also social distance. Musa, we are tired. No, Nanto. Getting vaccinated is a very good step you took. However, COVID-19 vaccination doesn't prevent you from contracting the disease. Musa, you see? Don't so fast, Nanto. The COVID-19 vaccines we have in the country are free, safe, and effective in preventing severe disease, hospitalization, and death. That's why even after being fully vaccinated like you should continue to wear your mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water, or use an alcohol-based sanitizer. Maintain physical distance of at least 2 meters from others, and avoid crowds and social functions. I haven't been aware of the need to continue observing the SOPs to the dot. Thank you for the great information, Mr. Okate.
It's a COVID-19. This message is from the Ministry of Health with support from UNICEF and partners.
Spectrum on Radio 1 FM 90.
Brought to you by Housing Finance Bank, a financial institution regulated by Bank of Uganda. Housing Finance Bank, we make it easy.
The views expressed on this show are not necessarily those of this radio station or its management.
Broadcasting from the heart of Kampala, the news on Radio 1.
Brought to you by